Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, you can call them digital certificates, vaccine passports or COVID-cleared tests. The whole world is grappling with the same problem right now. How to let people prove they can interact freely again without the disease in a way that won't be divisive, won't be forged and won't make people feel robbed of choice. Here, the government's resisted the idea of a click-up passport. Others, China and Israel, have already signed up to a system, and the EU will have its own plan in place later this month. Mark Urban has been taking a look at how it's been working in Israel.
Nowhere on earth has seen anything like it. Israel has now vaccinated a third of its population against COVID.
A lot of data coming out of Israel, so let's take a look at this, because in a lot of ways they have really been the model. They jumped out very early ahead in their vaccine program.
Israel is getting back to business. Bars and restaurants reopened on Sunday. The latest step for a country that's led the way in vaccinating its citizens. Even so, they've rejected making the jabs compulsory, and they're trying to nudge measures instead.
So what we see here is that sometimes over-motivation, doing activities that maybe on the paper seems like good idea to try to force or to push people into getting vaccinated, they are not professional, they are not working well. What we need to do is the same as any other health behavior, to encourage people, to support people, to get the vaccines available as much as possible, and then we can get people vaccinated.
This gym in Tel Aviv has been back in operation since last month under a phased reopening plan. Those who work here have all been vaccinated.
This is the reason we do it. We're young, we touch each other, we train each other, we go out, and we've done, like, I got vaccinated and Oren got vaccinated and all of my trainees got vaccinated just to train and keep on life. You know, we want to travel, we want to train, we want to go out to restaurants, we're young, we want to live, and we have to do what we got to do, you know.
At the entrance desk, they check customers for a green COVID pass, generally a phone app. And if you haven't got one, you exercise outside. So does it turn the non-vaccinated into second-class citizens?
Vaccines are available to everybody, so there's equal opportunity to be vaccinated. This is not our choice, it's your choice, okay? We are not telling you don't go in. You are choosing not to do the act that would allow you to rejoin, you know, others. So it's your choice. You can't complain once you are choosing something that it limits, you know, other things that you might want to do.
For most users, the Green Pass is an app, but you can also print it out in physical form. You can get it if you've had both vaccine jabs, had COVID, or a very recent test. You don't need it to go to the supermarket or other essential services. You do to go to the cinema, health clubs, bars and restaurants. Children have not yet been vaccinated, of course. There are 3 million under 18s, about 1/3 of the Israeli population, and that's where most cases still are. A few 100,000 adults remain reluctant to take the jab too. Now rules are being readied to force those who won't get the injection but do work in some professions, like teachers, to be tested every 2 days.
For me, it's funny because I would probably do a lot to avoid being tested for COVID every 2 days. But it generates less resistance. So as long as that those people who are against, you know, being vaccinated are willing to be tested, that's okay by us.
One of the other big question marks concerns Palestinians in the occupied territories. Thousands of workers cross daily into Israel. Vaccination is still at an early stage in the West Bank and Gaza. The Israeli government saying it's the responsibility of the Palestinian Authority, but its critics feel doing more is a no-brainer.
So we want to get the Palestinians vaccinated. I cannot understand why the Israeli Prime Minister is willing to donate vaccines to all faraway countries before he's getting these vaccines to our close neighbors. Israel started vaccinating Palestinians working in Israel. That's, good step forward, but I think we should do much more actively to aid in the vaccination campaign for the Palestinians. Unfortunately, the Israeli government is progressing too slowly.
There's still an air of novelty about opening up Israel and the Green Pass. Inevitably, some wonder whether the early enthusiasm will give way to boredom and ignoring the rules.
Well, Israeli population is generally not a very compliant one. So it's reasonable to expect, for example, gym owners or obviously museums, movie places, cinemas, and so on and so forth to check for what we call the green badge. Because you can, apply in advance, you buy tickets in advance, you can show your badges and so on. I'm really skeptic about restaurant owners. That would be really hard, especially for the small ones.
But for the moment, Israelis are revelling in the possibilities that mass vaccination and the dramatic drop in transmission and deaths have brought. With the UK reviewing its own possible vaccine certificates, Israel has become something of a testbed for finding a new normality.
Mark Urban with that report. Well, joining us now is the director of the Vaccine Centre at the London School for Hygiene and Tropical Medicine, Beate Kampmann. And Professor Kampmann, we've just seen how they're sort of doing things in Israel. Do you think we will end up going down that green badge route, something similar to that?
Yeah, good evening, Emily. Well, as a public health measure and from an infection control point of view, I don't think we should exclude this option. However, at the current time, I don't think we're in a position it would be premature. And I'll give you 3 reasons why I think we're not yet in that position. Because we don't yet have conclusive evidence that vaccinated people do not transmit the virus. We haven't given access to all of the adult population to the vaccines. And we also don't yet know how long the protection lasts. And therefore, I think it's premature in the UK.
So, I mean, what is the vaccine for? I mean, I know what it's for, it's to save lives, but how can you use it? If people are starting to ask now, we've had the vaccine, but you're not really seeing a way of using that in a practical way to sort of get your liberties back, where do we go?
Sure. I mean, we're using it in a very practical way at the moment to stop people from getting into hospital, getting seriously ill and dying on ventilators. So that's one thing. But as a public health measure there are really 2 issues when you get vaccinated. One is to protect yourself, and the other one is to protect the people around you. And the protection of the people around you is certainly achieved by the vaccination as well. We don't yet have a good idea to what degree, and that data are emerging. And as we're extending the vaccines to different parts of our society as well, we'll get more and more data about that. But, at the moment, we're really having a mix of social distancing, lockdown, masks, and the vaccines introduced into our society. So therefore, it's a little bit difficult to unpick exactly what contributions the vaccines make. And also, we haven't yet vaccinated populations who might be exactly the populations who might want to go to a music festival or big gatherings where transmission risks are much higher.
I mean, the key point in your, as you laid out the scenarios, is really that big question of whether the vaccine cuts transmission. And you're saying we won't know that for a long time yet?
Well, not necessarily a long time. So there are studies going on from the Office of National Statistics where people getting their noses swabbed on a regular basis who have been vaccinated. This is follow-up of various vaccine trials. So we will get that data, I would think, in the next few months. And then we have more certainty around it. But, there are also technical and legal and ethical issues around the idea of the vaccine passport. But purely from a public health point of view, I think we should really seriously look at it.
I mean, isn't the problem that, as I think the EU were explaining when they were going down this route, if governments don't do it, then private companies will? That it will just be taken over by, the commercial sector?
Sure, but there are legal implications as well, because, will you be excluded from work if you haven't been vaccinated? I mean, just give you a couple of examples. If you're a doctor and you want to practice surgery, you have to have hepatitis B vaccine and be hepatitis B negative so that you don't pose a risk. So there are other reasons why we have sort of mandatory vaccination for certain professional groups.
Beata Kampmann, thank you. Thanks for joining us.